Welcome to another episode of Second Opinion with Dr. Mehdi Parekh. Health talk so simple, even your grandparents will relate and agree to it. आज it's straight from the heart. Dil Se Dil Tak. A game-changing conversation on heart health that can save a life, maybe yours. Joining us today is Dr. Kaushal Chhatrapati, one of South Mumbai's leading interventional cardiologists who not only saves lives inside the hospital but is also passionate about saving lives outside the hospital by creating awareness. We're excited to have you here, doctor. Starting on a personal note, out of all the medical specialties, why cardiology? What pulled your heart towards the heart?
Very interesting question. Somehow, Mehdi, you won't believe, but right from my school days, I wanted to become a cardiologist. And that's something which was very passionate inside me. I have seen my grandmother die of a heart attack when I was in schools, and I always thought that this is one area where you can make a direct difference. And today, I don't think the job satisfaction you can derive in cardiology, you can derive in any other field, because I have literally treated patients who have come dead to the hospital casualty, and we have given them cardiopulmonary resuscitation, taken them to the cath lab, opened the artery, put a stent, and they are living and very fine in the pink of their health today. So I think the job satisfaction which this branch offers, no other branch offers.
Very inspiring. Coming to reality today, every family knows at least one person suffering from any heart disease. Even 25, 30-year-olds are collapsing. What's going on? Why so sudden? Why this dil ki bimari is so prevalent in India? And why so young? Why so young age?
Yeah. So I think a lot of people are blaming a lot of things, right from COVID vaccine to any other thing, which may hit their imagination. But I think one of the most important aspects because of which young people are suffering from heart disease is a massive change in the lifestyle of young people. We are not the same. The young today are not the same when we were young. We used to live a more disciplined life. We would hardly eat out. Today, if you see the young people, they eat out on a daily basis. They go to Starbucks or McDonald's, and each and every portion of Starbucks or McDonald's is 1,500 calories. Even Frappuccino is so much, is having 1,200 calories sometimes. That's almost half of your daily caloric requirement. Also, that's full of fat and full of unhealthy substances. So, the one is that exercise has become very rare with a lot of competition going on. The life has become stressful. There's no time for exercises. People just go to and fro from their work, and that consumes all of their time. Also, habits have changed. If you see today, 70-80% of youngsters are smoking. Yeah, especially women. And I asked one of the young patients of mine who was like 17 years old in college, and she was smoking, and not only her, all her friends were smoking. And I said, why are you smoking at this young age? And what she told me just really shocked me. She said that because of smoking, my appetite is killed, and therefore I can maintain my figure. This is something which is really, really surprising to me. This really came as a piece of shock, and that's why, in fact, today young women are smoking much more than young men.
Mm-hmm. So, before any of the heart attack or any of the warning signs which comes up, so there's always a trailer before the movie. How do we recognize that? How do we know?
Very important question, and this is in 99% of the cases there is a trailer. But the thing is, we are in denial to recognize the symptoms of heart attack. A lot of us think that this is just acidity. A lot of my patients ascribe it to acidity. In fact, in our own hospital, in Saifi Hospital, there was a young resident in radiology department whose father had succumbed to heart attack, and he had acidity symptoms for 2 to 3 days, which he neglected. And then, unfortunately, he had a massive heart attack, which he succumbed to. And he was just 29 years old. So if this is the case amongst doctors, you can understand what is the situation amongst lay people. So any symptom which you have, breathlessness, increased tiredness than before, uh, acidity, any feeling of uncomfortable, uncomfortable feeling in the body should never be neglected. And this is especially true in women and in diabetics, because in diabetics we have something known as silent myocardial infarction. So the symptoms are not typical chest pain, but such minor, variations from being normal. So you have to be very, very careful. 50% of heart attacks in diabetics are silent. And even in non-diabetics, 25% of heart attacks are silent.
Right. So every chest pain is not gas ki bimari, and we can't just neglect those.
In fact, anybody who is above 35 years of age, any chest pain which occurs, which is unusual, which is alarming, should always merits an ECG. Any abnormal ECG, and if that ECG is normal, another ECG, say after some interval, and if any of the ECG is even slightly abnormal, then an entire cardiac profile should be done, and a cardiologist should be involved.
Okay. So someone suffers a chest pain, be at home or office. So what are the things that he or she as a person should do? Or if they suddenly collapse, so anyone nearby, what's the next step that someone could take to save a life?
Fantastic. So I'll take this question in two parts.
Mm-hmm.
First part is, what are the normal signs and symptoms of a heart attack, and how should one react to it? Now, heart attack does not proclaim I'm coming and then come, right? It will come out of the blue, all of a sudden, unexpectedly. So if that is the case, then any chest pain should merit a serious investigation. So anybody above 35, if he complains of chest pain, then we should always treat it seriously. Take him to a tertiary care hospital, get an ECG done. If the ECG is abnormal, then get a cardiac enzyme done and call the doctor. You don't have to wait for any reports. If the ECG is showing signs of a heart attack, then involve an interventional cardiologist, and angiography and angioplasty should be done as soon as possible. Okay? Because sooner the angioplasty is done, sooner the artery is open, better is the prognosis. Because there is something known as door to balloon time.
Right.
That when the patient enters the casualty, within 90 minutes, he should have his artery open. That confirms maximum benefit. The heart muscle starts dying the minute the artery supplying blood to the heart gets occluded. And therefore, this dying starts within 1 hour and it continues till 6 hours. And then in 6 hours, 75 to 80% of the muscle supplied by the artery is dead. So sooner we open the artery, better is the prognosis. So that is one. And if the patient collapses, then one thing is very important. Each and every one of us should be trained in imparting CPR, cardiopulmonary resuscitation. And this is not only to doctors, it is to lay people. So which are the areas in which are the people who should be trained in CPR? So most importantly, gym trainers. Somebody who's in the gym, because a lot of the sudden deaths occurs in the gyms.
Right.
So if the gym trainers are trained about cardiopulmonary resuscitation, a lot of these lives will be saved. Also in school, regular CPR camps should be conducted, and school students should be made to perform CPR drills on mannequins.
Right.
And I have seen one case where a school student has saved his grandfather from a cardiovascular collapse. He has given CPR, he has come back, and then we had done the angioplasty, and he's doing very well.
So children today are the future of tomorrow. If not today, at least the next generation will have such a generation.
And it is not so difficult. One of the major hindrances in widespread adoption of cardiopulmonary resuscitation was mouth-to-mouth resuscitation. Mouth-to-mouth resuscitation does not only have certain cultural barriers, but also hygienic barriers. Not everybody would like to give mouth-to-mouth resuscitation to an unknown person. There was a risk of even diseases being transmitted that way. But now, according to the latest guideline, it's hands-only CPR. So there is no need to give artificial respirations. Just chest compressions done in the right way can save a life. And so this is also very important. CPR does not involve mouth-to-mouth respiration nowadays. It's just hands-only CPR. Just learning this can save a life.
And if a normal person wants to know if his or her heart is healthy or no, so what's the simplest thing they can do?
So this is very important. So I would say that age of 35 is an age where every person needs to pay attention to his heart. Basic safety checks should be done by all people. This includes a complete body profile, total body profile, which should include a HbA1c, that is the 3-month average of blood sugar values. He should have a stress test. He should have a 2D echocardiography. He should have kidney and liver functions checked. And he should have cholesterol checked. Especially the LDL cholesterol, there is generally no symptom. And even if you're thin, even if you're eating the right diet, that does not guarantee that your cholesterol will be normal. 85% of cholesterol is genetically determined. So if you have it in your genes, then your cholesterol may be high even if you were doing everything right. And therefore, it's important to do all these tests. I call this birthday testing because I myself, for last 15 years, have been testing my total body parameters on my birthday.
Okay,
Because that's something which I won't forget.
great idea.
Yes. So I call it birthday testing. And it's been very helpful to me, and I can monitor my parameters so that I can have a healthy parameters.
Most of these tests are done in Phoenix, so just in case anyone wants to turn up over here.
Absolutely.
So my next, as we were talking about tests, so what are those annual blood tests someone should go into, get themselves checked, or if someone has a family history, do they need to start earlier, or 35 as you said? So is like, should we take that as cutoff age or something plus?
No, there is no cutoff age. Like I have myself done angioplasties on people who are 19 years old also. So there is no cutoff age. So any chest pain which is typical should be treated with utmost respect. But and all these tests, there is no lower limit at which you can start. Of course, if there's a family history of early cardiac death, then all these tests should be started maybe earlier. And these tests are basically, as I said, for heart, you need to have HbA1c, you should have 2D echocardiography, stress test, and fasting lipid profile. These are most important tests. And then if there is any suspicion in these tests, then accordingly you can have something like CT coronary angiography, or if the stress test is strongly positive, you may directly even go to coronary angiography. So these tests are basically to diagnose heart diseases earlier and earlier in a patient's life, and to prevent catastrophic consequences.
So अभी like we Indians हमको we relish pav bhaji, butter chicken खाते हैं, samosas. So honestly, for a healthy heart, do we need to sacrifice all of these? Yeah, enjoyment or heart health ka balance pe, matlab, how do we go about?
So I'll tell you something, Mehdi. This is a very important question, and I always say moderation is the key. Human mind is such that if you forbid something, forbidden fruit tastes the sweetest. So if you say you can't eat something, then if I tell you not to think about a pink elephant, the first thing which will come into your mind is pink elephant. Similarly, if I tell you not to eat pav bhaji your entire life, you'll be dreaming of pav bhaji. So I never tell my patients not to eat something. I tell them you can eat it once in 15 days. Now, very frankly, if you eat something once in 15 days, it's as good as not eating it, right? But at the same time, you won't have the trauma of not eating it at all. Like many people don't eat very sinful foods on a daily basis, like a cake or ice cream. Nobody eats it on a daily basis. But once you tell them you can't ever have it, they get a trauma.
Right.
So I don't do that. Moderation is the key. And finally, if certain parameters are off, we have to treat it with medicines. And then the patient can enjoy the occasional indulgences. But of course, patient who is diabetic has to be very careful in his diet. He should not have a high sugar diet because otherwise it's impossible to control. You can't just go on increasing the medicine again and again. That's not a good strategy.
And based on this lifestyle only, along with the eating habits, the stress and deadlines and tension. So one part is the eating habits, other part is all of
this stress. So can this tension or deadline or stress alone be enough to cause a heart attack?
Yes, yes, of course. So normally a person has several risk factors, but there are a lot of times when stress is so stressful and it completely occupies the person's mind, it is enough to give him a heart attack. Anger is one common uh, 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 predictor of not only heart attacks but even strokes. Blood pressure shoots up. There are physical changes which take place in moments of stress. Financial stress is one of the biggest killers, and constant stress about not having money is something which plays on you. So I've read a very interesting book, Mehdi, Why Zebras Don't Have Ulcers. Okay. Now, zebra, if you consider life of a zebra who's grazing in the savannah, okay, you may think he may have a stressless life, but it's not stressless, right? Because the lion will come running
Right.
and he has to run to save his life, right? Now, even then, the zebras don't have ulcers. Why? Because as soon as the lion stops chasing him, zebra forgets about it. It's back to grazing in savannah. It does not have the memory of it, does not continuously stress about it. This is something which is called episodic stress. But we humans have chronic stress. We continue to think about something which is going to stress us and we never leave it. So this causes a lot more side effects, It's sometimes we should all be like zebras. Zebra does not have the mental capacity to remember and stress about things which have gone. It won't think that lion will kill me tomorrow and stress about it today. So things which we cannot change, we should accept and not stress about this. In this regard, we should practice something like meditation, yoga, calming exercises. This goes a long way.
Acha. So even after all of these precautions, someone still has some cardiac issue, some heart problem. So how do they go about? Here, we and the general layman people, when they hear of all these scary words, ECG, echo, TMT, stress test, angiography. So, like, what is needed when, and exactly what are those things? How does a normal person know as to what they have to, undergo after consulting a doctor? And what's the difference? What are all of these?
Yeah. So it's very important if you have any symptoms like breathlessness, chest pain, angina. What is angina? Angina is chest pain or breathlessness which increases on exertion and is relieved after resting for a couple of minutes. This is typical anginal pain. If you have any of these symptoms, or if your cholesterol is very high, or anything like that, you should always consult a cardiologist. And the cardiologist will look after your reports and he'll decide what is the next best thing to be done. For example, he may give you some medicines. He may lower your cholesterol by giving medicines, control your diabetes by giving medicines, and if your stress test is positive, or if your 2D echo is showing some what we call regional wall motion abnormalities, he may guide you to the next best thing, which may be coronary angiography. Now, first of all, when you go to a doctor, think 10 times before choosing your doctor. But once you choose a doctor, trust him blindly, because once you choose a good doctor, he has your best interest at heart. So if he tells you to do angiography, don't think much. You should do angiography. Angiography, if it shows blocks, it may be treated by either angioplasty by putting a stent, which is nowadays done in 85 to 90% of the cases, or in some cases where the blocks are too many, one may require a coronary artery bypass graft. So these things you should go to a doctor, and you have to put full faith in the doctor.
And after having this bypass done or a stent put in, can life turn back to normal, or the heart is never healthy again?
Absolutely, the life can turn back to normal, because that's the reason why we are doing these things. If you go back to the 70s or even 80s, when routine angioplasty and bypass surgeries were not so prevalent, after a heart attack, patient was advised 1 month of rest, bed rest. No, that is so counterproductive, because with 1 month of rest, your muscles will become weak, your body will start wasting, your mindset will be troubled. So to come out of that We have taken out angiography, angioplasty. And I'll tell you, after angioplasty, even after a heart attack, patient is home in 2 days and can start a normal life almost immediately. In fact, I had a very wealthy patient who was a builder, and I did his angioplasty on a Thursday night. And Saturday morning, 8 o'clock, he had a very important meeting with some investors. And he was adamant he wanted to go to that meeting. I said, you can go. I did the angiography radially, and after 2 days, he attended that meeting. So, yes, you can completely resume normal lives. And here I will also tell you, a lot of patients hesitate about their sex life. A lot of people assume that having a heart attack means they can never have a normal sex life. Nothing can be farther from truth. In fact, having sex protects you from heart attacks. And that has been recommended that at least 2 or 3 times. If you have indulged in sexual intimacy with your partner, it prevents you from getting a heart attack. So this is something. And even after a angioplasty or a bypass surgery, you can resume normal sex life within a few weeks. And most important determinant is your ejection fraction. But having said that, sex does not take a lot of energy, just like climbing 2 flights of stairs. So yes, so all this is very important, and somehow it is lacking, and patients are not explained about this.
According to your experience, some simple practical rules for a healthy heart life.
Yeah, so I'll tell you, maybe everybody knows these rules. It's just that we don't want to follow it. Nobody who's smoking will think this cigarette is going to lengthen my life. Nobody who's eating gutka thinks that this gutka is good for me, right? So everybody knows the rules, but the thing is to follow it. And I always say, don't go crazy. Moderation is the key for heart. Heart does not like any extreme. If you have heart disease, you shouldn't start running the next day. You don't have to run the marathon. In fact, running the marathon can be detrimental if you're not in the pink of your health, right? So, balance of everything, okay? Regular diet, regular exercise, take care of your blood pressure, diabetes, cholesterol, and get yourself checked regularly. Or have a nice sleep. Avoid stress. Sleep is very underrated. 7 to 8 hours of sleep is required for every healthy adult. And I would go to the extent of saying that a lot of my patients tell me that I didn't have proper sleep because I had to go to the gym at 6 o'clock in the morning. Now, nothing can be worse than this. If you were to choose between sleep and gym, choose sleep always. Sleep will benefit you more than gym will ever will. And being in the gym with an unrested body is one of the risk factors for cardiovascular events in the gym.
And we see so many all of these viral videos, WhatsApp forward, social media, reels.
Yeah.
What should be followed, what not? Dil ki bimari hai to mirchi ka tel piyo, garlic paste khao. How do we know what we need to follow and what's right and what's wrong?
A very interesting question. And this is something which bothered me a lot, to tell you the truth, Mehdi. And therefore, I have started making reels on my own. And my Instagram ID is Dr. Kaushal Chhatrapati, if anybody of you wants to see. So, a lot of these things which are paraded are nonsense. Mirchi ka paste will not cure, or adrak ka chai or garam pani in the morning will not cure your heart disease. That's normal. Just follow the practical tips and do not listen to magic cures. Because people who promote magic cures are charlatans. They're here to grab your money. That's it.
People, to save themselves from all of these stress of the angioplasty and, undergoing SODA, they try to find some other way out.
Yeah, it is basically, they are preying on the weak mindset of people. Because people are scared of angioplasty, angioplasty. But actually, there's a very good quote by Madame Curie. Nothing in this world is to be feared. It is only to be understood. So if you understand what heart is, if you understand how simple angiography and angioplasty today are, you will no longer fear it, and you will not be prey to these charlatans. So that's something which is very important, which I think should be popularized. So that's why I want to. In fact, I'm even writing a book.
Right, yes.
I have written the book, and in next 2 months it should be available. We'll do a podcast again once my book is released.
Sure.
Yeah. So this book is about heart, and it is for lay people. So in my preface of the book, I have written that this is a book for the gardener, not the botanist, for the mechanic, not the automobile engineer. You know, the common facts about heart, what should be done, what should not be done, and a lot of what I tell you right now is all in the book, and that would be a guide. You know, so the book is a manual for anybody with a heart.
Great. So yeah, this is the concept of the podcast itself. You know, all of those medical jargons, rather than that, a simple talk where, you know, everyone relates to, even the common person should
Absolutely.
know exactly what's going on. Great idea. Rapid fire questions, simple short answers rather than all of the thing. If the heart had a WhatsApp status, what would it be?
Stay calm, keep beating.
One habit you wish every Indian should quit.
Smoking, definitely, and start exercising.
One Bollywood song that the heart can relate to.
Dil dhadakne do.
What's more dangerous for the heart, butter chicken or a breakup?
That's very important. Now let me expand on this because you. Okay. So both are harmful, but I'll tell you something. You know, breakup can kill a person. Breakup can kill a person. There is something known as Takotsubo cardiomyopathy. Yeah, and what is Takotsubo cardiomyopathy? This is when a person has extreme emotional pain. When a person goes through extreme emotional pain, whether it is a severe breakup, whether it is loss of a loved one, or whether it is a huge financial loss. These are acute stressors which sometimes cause the heart to become weak. The patient has chest pain and ECG is almost exactly like a heart attack. But only way to differentiate between a Takotsubo cardiomyopathy and a normal person, this is known as stress-induced cardiomyopathy, is on a normal heart attack is to do coronary angiography. In coronary angiography, the arteries will be normal in Takotsubo cardiomyopathy. But the point is, this is reversible. And if you give drugs like beta blockers and other anti-failure drugs, Takotsubo cardiomyopathy can be completely reversed. So between butter chicken and breakup, both are dangerous. But today, I think Gen Z, they just take breakup in their strides, right? They have a breakup every week, probably. Yes.
So it also depends on the level of stress they have after.
Yes. Nowadays, breakup is part of life. Yeah.
If the heart could talk back to doctors, what would it say?
So they would say that, you know, tell your patients what is healthy lifestyle and how to stop abusing me, right? And these are very common things which everybody knows, but you just have to stress them. And heart is like a pump which never takes rests. Right from the moment you are born till the moment you die, it will continuously work. It will beat 70 times a minute, sometimes more, till the entire life. And it does not ask for much in return. It just wants you to be healthy, exercise regularly, don't eat junk food, have nice rest and sleep. That's all it's asked for. Is it too much?
What's more shocking for a heart? India losing a match or a bill after the angioplasty?
A very interesting point. You know what is most shocking for the heart? Not having that angioplasty. Okay, because then the heart would be dead. But you have raised a very important point. In India, unfortunately, budget is a major hurdle in face of people in front of people who want to seek medical help, because there is no good universal healthcare which is available in India. And I think we are getting there, but it's still early days. So what I would advise everybody through this forum is to invest in a good medical insurance. And that medical insurance should be at least 20, 30, 50 lakh rupees. And it can be a family floater, no problem. But at least 20, 30, 50 lakh rupees, because treatment nowadays are getting more and more costlier. In fact, in heart, it's not so costly, but in other fields like oncology and transplants, it's very costly. So everybody should have a 30 to 50 lakh rupees insurance.
We don't have any setting with any medical insurance.
No.
It's just
No, this is straight from the heart.
Yeah, so this brings me to the next and the last question. One message from you to every listener's Dil.
The last question? Okay. So, Dil Se. Ekdam Dil Se. अगर आप अपनी हार्ट का अच्छे से ख्याल रखोगे तो पूरी कायनात जुट जाएंगी आपके हार्ट को हेल्दी रखने के लिए.
Wow, great.
और if you have a heart attack, if you have a heart disease, it's not the end of the day. You can still change your habits. Tomorrow is another day. And picture अभी बाकी है मेरे दोस्त.
Thank you so much. Thank you, sir, for sharing all of these valuable insights and experiences of yours.
So, friends, healthy heart, happy life, simple. This was another episode of Second Opinion with Dr. Mehdi Parekh. See you, stay healthy, stay safe.